Well, I wanted to welcome everybody. I'm really excited you're here. This is on the Facebook feed that I did. This is our journey to genetic perfection, so that you all can look as good as I am. So one of the things that is always fascinating to me, I mean, obviously our genetics, that plays a huge role, and we also have the epigenetics in regards to what we eat, what kind of environment, how we're thinking, our lifestyle, and how that kind of turns genes on and off. And those are things that we can change and that we can have control over. But then you come to the things where you feel that you don't have as much control over, which is the kind of the hard programming that you had, and we wish to kind of blame everything on our parents, and actually we can at this point, because they gave it to us. So in regards to the genes, we're finding out more and more there are things that can be done, and we see that there are health issues that you have people, and I see this with patients all the time. They take a supplement and it just really doesn't do what it's supposed to do, or they are trying to build up their gut lining and they take the right probiotic, they take the right things, and it just doesn't fix it. And also it was funny, I was reading one of my when I get bored at night, I read these big books. So talking about the IgG and how to build up the IgG, which is really important nowadays when IgG has to do with how you're able to respond to immune stressors. Like for instance, you have a virus. How are you going to be able to respond to that virus? Well, you need an immune system response to that. So you need an appropriate amount of IgG in order to be able to do that, or IgA or IgM. And these are different antibody components that then responds to these viruses or to these other different pathogens. So what I was seeing is that if we're trying to build up IgG with certain nutritional supplements, if we are not looking at our genetic dysfunctions and correct them appropriately, it's going to take a much longer time to be able to do that. And that is just one example. So we're looking also at detoxification. Now, let's say you've been exposed to heavy metals and you are feeling brain fog, your detoxification that drive kind of the endocrine balances, that all those pathways are optimized because we know that they are already challenged. And we are living in such a world now that we're dealing with so many more challenges than what we're used to. I mean, the amount of toxins now compared to 50 years ago. And then we look at the other side of the equation, the lack of nutrition we're dealing with now compared to 50 years ago. So it just means that we now have to be even more diligent and more targeted and more focused, and to maximize the little we got, because we have less nutrition, we have more results. So we really got to be very conscientious as to what kind of nutrients we need to bring in and how can we maximize that. And that's looking at the genetic aspect, that becomes a really amazing and powerful tool. One of my challenges that I had in regards to the genes, you have like the 23andMe is a common one that you do, is that for the average individual, an average practitioner, it is very challenging. It becomes a big bear, and you have to kind of really sit down and focus on it for at least half a year in order to be able to be really good at it and be able to guide people. And for the common person, that becomes a challenge as well. So I haven't really done that too much, so that's why I was so excited then when I found something where it was a much, I think it's a very slick process, meaning that you just kind of scrub your inside of your cheeks and send it in, and then it tells us what it is that we need, and then they formulate that and then send it to us so that we can maximize the different genes that we have. So what is cool is that we're able to get the individual that is putting together all of that formulation and that put together that whole process, and she's going to hang with us today. So I'm excited about that. But before, I want Dr. Harmon, my sidekick, or I'm his sidekick, I don't know. I think I'm the warm-up, kind of like the warm-up band, and then And yeah, Dr. Harmon, do you want to come and chat a little bit?
Yeah, he warms up the crowd for me so that you'll be able to tolerate it. Well, thanks a lot. I'm not going to talk very long, but I do want to tell you a little bit of a story. In my former practice, I've been a chiropractor for 32 years, but I used to do oxidative medicine, and I used to order stool tests on people for gut issues, obviously. And I would go over this report, and the report would come back, and on the left column would be the good bacteria, you know, lactobacillus, bifidus, and all of these on the left. Great Plains Laboratory. You're nodding your head. She's probably done some too. So the good bacteria, the good guys. The middle column would be, they're not hurting you. They're not doing you any good. They're just taking up space. They're taking up the space that where the good bacteria should be growing and flourishing. And then if they had any in the right-hand column, these guys are harming you. They're fermenting things and producing toxins. We got to get rid of those guys. I happened to have one of those at that time, and so it was really important for me to find out what that was. Because the one that I had, if you eat onion and garlic, those are the two worst things you can eat because they ferment it and turn it into poison. And you think, oh, I should be eating more garlic and onion, but it's not always true. But that's not my point. My point was time after time I would order stool tests, and I would say, by the way, Mrs. Jones, you have very little lactobacillus or bifidus. And every single time they would look at me and they would say, I've been taking a probiotic with that in it for 20 years or 30 years or whatever it was, and I couldn't figure out what is the problem. We're giving them a bunch of good bacteria. Why can't they grow it? Why can't it, make a nice home? I used to tell people, it's like going into downtown Manhattan and say, hey, I'd like to buy a 10-acre farm. There's no real estate because it's being inhabited by things that aren't really good for you. But there's a bigger part to this story. In March or April, was it, when I saw you on this Zoom? Okay, I was on a BNI thing, Zoom, and Kim Ressler, I'm going to introduce you to her. She starts talking about this nutrition according to your genes. What? Yeah, nutrition. You do a swab test, and they find out what variants you might have, and then they formulate one formula only for you, for your genes. So I got in touch with her. I ordered my test kit. I got the test back, and she actually ran it by the geneticist for me that you're going to meet here in a minute. And I did not tell them anything about my health. I got it from Dr. Jan to Kim, and she said, does he have gut problems and sinus problems? And I said, that's been the bane of my existence. I mean, in high school, I made a decision not to go to Carmel with my biology class on a what do you call those? What is it? Field trip. You know why? Because it's summertime, and it's a long trip, and everybody would see me putting my sinus drops in my nose, and I would be embarrassed. I didn't go on the field trip because my parents took me to the doctor. Johnny keeps sniffing and spitting. Why do you keep doing that? I don't know. I just get this stuff. So here's the story. Dr. Jen said, with those variants, your gut lining can't make the stuff that nourishes the good bacteria, so they pass through into the toilet and the bad guys grow. That's the most profound thing I've ever heard about gut health. And if you've had gut health and you haven't had one of these tests done, you need to do it. I was told by a consultant for US Biotech, you should probably never eat sesame seeds or consume anything that has to do with basil in it, because I was so allergic to it. When I was in my 20s, I could eat rye crackers, chicken, and steamed vegetables. I was so allergic to everything. So I got my supplement, and I've come a long way. I did a lot of stuff, but there were just a few things that I couldn't figure out. So I've been using, we got my formulation about 10 days before we went to Hawaii in May. And the first thing that I noticed that I didn't react weird. Usually I would take vitamins with a bunch of stuff in it, and there was something in it that I didn't feel good. And then it would sit in my shelf for a long time. Anybody have that? You buy something, the commercial says I need to take CoQ10, so I go to Costco. Well, do I need ubiquinone or do I need ubiquinol, and what ratio do I need it? Your DNA tells you that. Had some other things that made it was like somebody shining a big stadium full of lights on my life, the health issues I've had. But now I just take that thing, my supplement that's made for me out of 400 million possibilities of dosages and substances. They formulate one thing for me. It has my name on it. Like this one behind me has Kim Wrestler on it. That meant a lot to me, the help that I got with the gut and the sinus things. I used to buy homeopathic nasal spray when I worked in Tim Clinton's office years ago. He probably didn't know it because I didn't tell anybody. I'm spraying this homeopathic nasal spray in 4 or 5 times a day just to breathe. That's pretty much gone. So I want you to look at the deeper, how far science has come from your DNA. They're going to tell you about these 18 variants that you can actually do something about. And I'm going to leave you with this, and it's a chemical formula. It's really not. It's really simple. Your body has to make different things in order to accomplish different things. It'll take something like A, let's say this is something you get from your diet, and it'll combine it with B to make C. C might be something that helps you maintain your cholesterol level, maintains your proper body weight, maintains your proper blood pressure. If you can't make B, you're not going to get C. So what happens is these chemical processes stop. They can't do something, and that's why when if you're like me, I've taken a supplement or a nutrient, and it just doesn't work. It made me feel worse, or I did this, or it just wasn't right. So remember, A plus B equals C when they're talking about these supplements. I want to introduce you to somebody who's become a friend of mine. Actually, both of these ladies have. It's really, I don't want to say unusual the geneticist is a really smart young woman. You'd think that somebody would be a lot older. But she is the formulator of these, what goes into the supplements. One of the things that really meant a lot to me as a practitioner is in each report that you get. When you get your report back, it'll say, okay, for this, the MTHFR, very, pretty well known for this, we're going to support your body and give it all of this. But in the back of the report, there's the peer-reviewed studies that say why that's in your supplement. Dr. Jen is who formulates that. Let me introduce you to Dr. Jen Myers, the geneticist for Euphoria. So you've got a lot to live up to there.
I'm not as young as he says. I just know my genes really well, so I'm kind of tailored to that. I actually have a 21-year-old now in dental school, so that's great. I'm Dr. Jen Myers. I am Chief Science Officer here with Euphoria Science. I have the coolest job in the world. I truly do. I get to study genetics. I have my PhD in molecular genetics. I have a doctorate in clinical nutrition, oriental medicine and acupuncture, Chinese medicine, which is part of that as well. Also in, oh my gosh, I don't mean to sound terrible that I forget them all. Natural medicine, biomedicine, I did functional medicine. I did it all because I wanted to understand the body as a whole, not because I wanted to be the smartest person in the room, because I'm not. There's some really smart people here, and I'm glad that I get to be here to speak with you all. But I wanted to understand the body from a holistic view. I came from obstetrics and gynecology, and I just remember our patients saying, gosh, I'm I don't react the way I think I should react to these hormone replacement therapies, or I really don't want to take this stuff and be dependent upon it. Is there something more natural I can do? And in bio-Western medicine, we go, no, there's not. And I just remember hearing this over and over and over and over again. And then during childbirth and delivery, you deliver these babies, and then all of a sudden, okay, it's all about the baby, and the mom's there, and she's so depleted. And she's so depleted in so many things, and now we're like, here, hook the baby up to your breast, and now breastfeed, and now take this baby home, and good luck, see you later. Well, I come from Canada, I will own that, where medicine's a little different, and we follow the moms for a while. So I started to think about things like that and think, well, why are these moms struggling? Where's postpartum depression coming from? Why are they dealing with these things? Why are men having a hard time and struggling with testosterone levels, and then their estrogen becomes imbalanced? All these things started popping up in my head, so I said, okay, I know we test the MTHFR gene. Who all knows what that means before I just start? Okay. Methyl-tetrahydrofolate, right? So this is a methylene pathway. It prefaces over 250 plus biochemical processes that you do on a daily basis. It puts energy into a cell so you can function. So you can feel good from 6 a.m., 5 a.m., whatever time you wake up until 10 or 11 p.m. when you go to sleep. That's your cellular energy. It helps you absorb nutrients. But in recurrent miscarriages, it was something that we looked at to see, is this a genetic variant that's happening and a cause? But we never really talked about why or how. And this is in Western medicine. We tell them, well, you have the MTHFR gene, you're probably prone to recurrent miscarriages, you should go see a reproductive endocrinologist. Off with you. Well, I didn't like that. I don't need to know all the answers, but I wanted to know more. So I went down the spiral of genetics, pathways, understanding what it does, how it makes your body function, how it helps you be more optimally where you want to be. I was kind of that person that was like, where's that limitless drug? I want to know what it is, where it is, and how I can take it. And I think that everybody wants to feel their best 120% of the time that they can. We all have off days, and that's okay. So going down these pathways and learning more about this, I went, oh my goodness, there's this whole world there that we are just not in biomedicine taught. You know, we don't understand how when you take a particular form of B9, how it can or cannot affect the body in a positive or negative way. How if you take a certain form of B12, how it can or cannot affect the body in a positive or negative way. And this is your foundation, this is your core, this is what puts everything that needs to happen into a cell, so the good stuff come in, the bad stuff go out, and you can have all the cellular energy to function daily. Well, that's kind of important, to function and to feel good. So I fell in love. So I remember standing next to my colleague, like it was yesterday, the hospital parking lot. We came out of really, really amazing C-section. I know that sounds terrible because, you know, C-sections are sometimes, this is my opinion, or sometimes not necessary, but this was a great one, and it was a great result for mom and baby, of course. But we're standing out there, we're having a good moment, and I told him, I said, I'm leaving Western medicine. I'm going to go study a bunch of crazy different types of medicines, is what they would say it is. I'm going to get into genetics. I'm going to dive down the rabbit hole. And he looked at me and he said, well, I'm sad for you. You're never going to make anything of yourself. You're never going to help anybody. You're never going to do anything. You belong here, and I'm sad that you're leaving. And I said, I'm sad that you feel that way. And I wanted to give him a certain little finger and move on, but I didn't. I closed in a very kind way, and called him years later and kind of boo-booed him, and now he is a fan of genetics, actually. So interestingly enough, it took me down this pathway to be able to help people feel and function better. It's the 80-20 rule, right? We can do all the things right. We can eat right. We can exercise. We can have healthy relationships. We can have a job that we love. We can do all the things right, which is hard to be 100% of the time, but we can. But then there's that 20% that the body says, just like Dr. Harmon, was saying, you go down these pathways, and if you don't have you have a particular variant that doesn't allow your body to function a certain way, you're going to stop. So what do we have to do? We have to learn, okay, what does that pathway look like? And then how do we bypass it, support it, and keep on moving? That's what we want to do. And that's that 20% that you could do all of it right, but there's that little bit that your mom and dad, thank you, passed down and doesn't function as optimally as it should. So with Euphoria, I was asked to come in at the beginning of the start of the company, which was about 4 years ago, not the start of the science, but the start of the company, to start formulating and to start writing genetic panels and reports, to start doing the research and the science. I was seeing patients up until the beginning of this year, and I just stopped doing that, and it broke my heart in a million pieces. And they come to my home, they come to my gym, they follow me everywhere, and I love them dearly, and I still help them as much as I can, but then I try to find other great providers to pass them off to as well, because I felt like if I could get more involved in the science, I could help a lot more people and work with a lot more wonderful and very intelligent healthcare providers to be able to help their patients on a different level if they wanted to, of course. So that's where Euphoria came in. I remember hearing about it, and at the time, when I was seeing patients, I was writing genetic reports on all of my patients. You didn't come to my office without getting a genetic report. I would run a minimum of 55 genes on my patients. My tests were about $650, and that was a good price. I've had a lot of patients, and we've heard a lot of people come in and say, I paid like $5 grand for one MTHFR gene. For one. They're missing this whole beautiful pathway, and they tested one MTHFR gene, which if it's negative doesn't mean you don't have a problem here. It just means they're not looking at the big picture. But $5 grand for one gene. Like, oh my gosh, these people are, I felt like they were getting ripped off. Like, that's not fair. I've even gone on as recently as last week, and was telling Kim, I said, there's companies out there who are testing, says just MTHFR, won't specify which one with the whole pathway for, what did I say, $450? Something like that. And I'm blown away at this. So when I found out that we could do the genetic testing, and I could compound and figure out how to compound for somebody based specifically to them, on whether they're a wild type, meaning you didn't get a copy from either parent, heterozygous, you get a copy from one parent, or homozygous, you get a copy from both parents. That's how specific I get to be. If you don't have a particular variant in most genes, we move on. Say, okay, you don't really need support from a genetic standpoint, let's move on to the next variant. Our algorithm and software then looks at another one and says, oh, you have a copy from one parent. We're gonna drop half of a clinical dosage into your formula, and then move on. Say you got a copy from both parents. We're gonna drop a full clinical dosage into this particular formula just for you, and move on. And that's what it does until it goes through all the original 18 SNPs, unless you choose another, the weight management report, which is a little bit different. But that's what we get to do. I was having a pharmacist do this. And he called me and he was like, man, this stuff's gonna get pricey for your patients to put this many things in here. But he said, but I tell you what, this is real medicine. This is cool what you're able to do. So now that we can do this at the price that we can, in the way that we can, as efficiently as we can, and get this to you monthly, I was all about it, of course. Like gave me goosebumps. It still gives me goosebumps. So what we do is we currently have 4 reports. And I think I'm just going to briefly go over these, and then Dr. Karlfeldt, if you want to come up and we can kind of go back and forth a little bit if you have things you want to talk about as well. The 2 that are DNA based, what does that mean? We look at your genetic variants and we formulate based off of those particular variants. We have your foundational health, or your healthy aging panel. I don't like to call it anti-aging because, well, anti is not really a good word, I don't think, and we want to gracefully age, right? We want to be graceful about it. We want somebody to say, yeah, she's really young, and I go, no, I'm not actually. Just kidding. So this is what this is foundational support. Looking at that MTHFR gene, or that cellular energy, looking at how your body produces mitochondria, which is energy that fuels all your cells. Looking at how you detox, right? So how you're exposed to these exogenous threats, whether it's molds or toxins, whether it's viruses, whether it's relationships, any of those things your body's going to react to. Your immune and inflammatory response. Okay, Dr. Karlfeldt said it perfectly. We want your body to react, but in a harmonious way. We don't want an aggressive immune or inflammatory response. My analogy for that is if it's aggressive, that means that there's somebody running around trying to find the bad guy, burning down the whole neighborhood, and the bad guy standing in the middle going, I'm right here, and a boo-boo. So your body can't do what it's supposed to do. It doesn't function as well as it needs to because it's in fight or flight mode, in other words. We're looking at things like heart health. Who here sees a cardiologist? Who here has ever taken any medications for blood pressure or for, hopefully all of you are gonna say no because you're here, or for lipids, right? For having high triglycerides or high cholesterol levels. So we're able to look at that to see if that's a genetic predisposition for you. Now, of course, there's the whole epigenetic factor that comes into mind. We're not talking about you can eat really bad now because you're taking this stuff. Well, no, you still have to do the 80%. We're talking about 20%. So you still have to eat well. You still have to be happy. You still have to have a good life. You still have to exercise. But we're coming in and supporting that 20% that we don't know unless we test, right? We don't know if we're taking the right form of B12 medicine, or I call it medicine, but it's actually, I guess, would be a nutraceutical. Who here has taken B12 shots? I have had so many patients that have come to me and they're like, I take B12 shots, but my B12 level doesn't change. It's either super high or super low. My homocysteine, which tells me how you're processing things and how healthy your heart is still not where it needs to be. I'm like, well, do you know what kind of B12? Well, I don't know, it starts with a C. Cyanocobalamin? Yeah. So I look at their genetics and say, well, your body doesn't take that inactive form, go through that process to make it active. You have a hiccup right about here and it stops. So you're just building up and you have really expensive urine. I'm sorry. Nobody wants to pay for things that they don't know that they're absorbing or utilizing. That's what we get to do, is to be able to see what form is specific for you, and within those clinical dosages, based on whether you're heterozygous or homozygous, have 1 or 2 copies from your parents to give you that proper dosage. So that's some of the things that the Healthy Aging is looking at. I try to be really simple when I write these. Like I said, I have the coolest job ever, so I get to write these things. 0 means copy from no parent, 1 means a copy from 1, 2 means a copy from both. We don't know specifically, so we can't go yell at mom or dad, except for mitochondria. We know our mitochondria comes from our mother. I looked at my mitochondrial genes and I was like, thanks, mom. So the rest I have to guess on. But if you'd like, I'll pass this around and you can look at this. I also try to give lifestyle recommendations in here too, just to help you guys out a little bit. Sometimes you understand this, but you go, okay, well, how do I support that 80%? You're helping me with the 20, what else can I do? So I will pass this around so you can take a peek at that. This is our CEO, this is Kim Ressler. She is gladly letting me share. There's no HIPAA issues here, which is the other thing. Before I get into this, we use a HIPAA compliant CLIA CAP certified lab, meaning you are a barcode to them. When they get we don't have any genetic tests here, do we, that's open? When they get your DNA swab, you literally come to them as a barcode. You register with us, we know who you are, but they see you as a barcode. They take your DNA, run the SNPs that I ask them to run, and send us the raw data. We then take the raw data and put it into form of your genetic test, as well as your formulation. All those fun years of schooling helped me figure out how to convert, how to understand, how to transcribe all this stuff, and that's what we do. Like Dr. Karlfeldt was saying, I used to look at 23andMe tests, and I wanted to bang my head against a wall. It's exhausting. It's a lot of work. I would have to charge a lot of money because it took a lot of my time to be able to read these reports with the raw data and convert it back to the patient in my own, and give them a report that they can understand. We can use software like Prometheus and different things, but they only show you very little specifics. They don't show you the big picture. There are nutraceutical companies that have their own software, but they tell you their stuff only. So you can take this information and understand what to take. If you, however, tried to do this, I forget, we did it once. It was thousands and thousands of dollars, I don't remember the exact number, to be able to take all of your possible formulations and put it together in one for you. It was a lot. I think Kim has 77 ingredients? 88?
87. I think it's 87.
I knew there was an 8 or a 7. Okay, 87 in hers. I've only seen 2 alike. They were brother and sister. I've seen twins that haven't even been alike. But I've seen a brother and sister that have the same formula. Otherwise, I haven't seen 2 that have been alike yet. Which is really neat, actually. This is our weight management. A lot of people struggle with weight loss. The inability to be able to maintain a healthy weight that's comfortable for them. Whether it's insulin resistance, right? They don't utilize insulin or glucose as well as they should. Whether it's the inability to be able to break down fats and carbohydrates. Whether it's the inability to be able to take the foods that they use to get the right energy to put out. Whether it's an addictive behavior. I mean, who knows people that just, I can't stop eating sweets. No matter what I do. We want to blame the microbiome, and it probably has a huge impact on it, but there might be something with their dopamine levels. Who knows the people that can go to a buffet and destroy it? Like they get their money's worth out of it. You're like, wow, this is impressive. Leptin, ghrelin, neurotransmitters that tell the brain, you have enough, okay, I see that the brain has enough fats in here, enough glucose, we're good, we can stop eating. That's leptin. Ghrelin says, ghrelin, that's how I tell everybody, I'm still hungry. Some people have an imbalance between those neurotransmitters. That's stuff we get to look at. So it's not just your basic, can't lose weight, oh, just eat better and exercise. What does that even mean? Stop eating the bad foods. I can't stop eating the bad foods. So at least we can help you understand what that could look like for you. And then we do formulate based off this particular DNA for weight management as well. We have an AM and a PM dose with this. This is just 10 capsules per day. You can take it however you need to. I was saying that I have to take two, like I have to take it throughout the day. Some people can take 10 at once. Some people take 5 and 5, that's up to you. Weight management is dosed very particular to address certain metabolic reactions. AM, we want the thyroid going. We want the metabolism to wake up. We want your body to move. We want to cut off those sugar cravings. Who gets that 2 o'clock, oh my gosh, I need sugar. Where's my Snickers? I'm raising my hand because that's me. It's actually more about like 6 to 8 o'clock at night that I get that. So this is helping support those possible genetic weaknesses. It's just, like I said, it's the 20%. You still have to eat right, but this is gonna help you be able to do that a little bit easier. So I'm gonna pass this around as well. The nighttime one, oh, I'm sorry, this is read a little bit differently. I don't remember if I changed that one yet or not at the time. This shows your allele results, A to T, C to G, who remembers that stuff from biology? And also shows your variance in a 0, 1, 2. The PM is looking to more enhance GABA. We want the body, we want the brain to sleep so the lymphatic system can do what it needs to do at night, which is get rid of all the toxins, right? We shouldn't be awake at night. Who has a problem where you're like, I just can't shut my brain off to fall asleep? I'm so tired, I want to go to sleep, but I can't. Could be a glutamate GABA, right? Something, glutamate's up here, the excitatory neurotransmitter, the one that's supposed to tell you to go to sleep is down here. We want to create balance, and that's what we're looking to do. So that's why there's an AM and a PM dosage. There's also help for male versus female. Men have different reasons why they can't lose weight than females. I'm sorry, but one size does not fit all. Surprise! It doesn't. The umbrella theory in science doesn't actually always work. So for women, we use DIM, which helps get rid of excess estrogens in the cells. It doesn't decrease your estrogen level. It doesn't take away from the fact if you are taking hormone replacement therapy, it doesn't touch that. What it does is it takes that excess, because where is estrogen stored? Fat cells. Takes the excess to help remove it. With men, we use a product called Testofen, which is fenugreek. Sorry, I just came from supply side where I looked at a million different ingredients, so my brain's clouded with amazing new products coming out, which is great for us, but fenugreek. And what it does is it helps support natural DHEA and testosterone levels in men. Doesn't take away from the fact that you have to take testosterone, doesn't decrease or increase your testosterone levels, just helps support it. So that's what we're able to do in the weight management, which is slightly different than the foundational. This is male and or female, and that one's based on gender. So those are the two that we do DNA-based products off of. We do DNA products off all of them. They're just not complete yet. So I'm working diligently on everything all the time. Sports and fitness. Who here likes to run? That's what I thought. It's usually like one or two people, and I'm like, good for you, because I hate it. And I know I hated it from day one. I was like a 2-year-old throwing a temper tantrum. I'm like, I hate this. I got my DNA back, and it says, you are not an endurance trainer. I'm like, yeah, I kind of knew that. You're strength and power. I'm like, I knew I loved to get in there and throw weights around. I knew I hated running. And that validated it for me. But what it also did was tell me, you know what, maybe you should work a little bit more at running. You're not an endurance trainer. It kind of gave me a challenge. I was like, well, yes, I am. Watch this. I'm still not. I'm still trying after years. But what it does is it helps you tailor your workout program a little bit better. Personal trainers love this because then they can focus on your strengths and your weaknesses. Are you prone to Achilles program a little bit better? Personal trainers love this because then they can focus on your strengths and your weaknesses. Are you prone to Achilles tendon tears? Tendonitis, where you get sore, achy muscles that it's prolonged days past where it should be. That's the stuff that we get to look at. So we can help you tailor your routine and at some point take something that's going to help support that based off of your sports and fitness regimen.
And the amounts that you put in, may I interrupt you for a
Yeah,
second?
of course you may,
I don't know
always.
if you're on
Oh, it's okay. Hi.
But
You'll have to rewind a little bit on the button.
I don't know what's going on there. But the amount that you guys put in is based on age and weight or anything like that?
Genetics only.
Okay. So based on my weight, it's the genetics, your optimum, you're feeding the optimum.
Correct. However, right, so am I correct in saying you're a healthcare provider?
Yes.
Okay, I kind of had a feeling, well, John kind of gave that away, but I had a feeling anyway. So you get the benefit of testing a patient's blood work, and you can validate everything we do with blood work. I can give the lab recommendations that, and I'm sure you actually probably even can relate them yourself. So say somebody has the VDR gene, the vitamin D receptor gene, meaning they don't convert an inactive form of vitamin D that they could get from sunlight into the active form that their body can use. So they get 4,000 IUs. We have to be really careful how much we can put in there. Unfortunately, I would put 10,000 in there,
There you go.
which I did in my UV shield because it's not DNA based. Have to be careful because in Canada, let's just say those darn Canadians, I can say that, so we're good, have certain guidelines of what you can and can't put in there in dosages. So let's say that you see your patients like with taking this, let's say they're about 40 on their vitamin D3 levels, and you're like, I want to get you more into the 60s or low 70s, let's do that. You then can give them the extra if they need it. Or if you see that a patient is overweight and needs a little bit more of something, then you can tailor it based on what you see. For people who are not healthcare providers, you can go to a healthcare provider and have them look at it as well. Dr. Karlfeldt, Dr. Hartman are awesome at that, and they're right here too. So they can look at your blood work and your DNA and your formula and see if you need to take more of something that's maybe not in there. But we're trying to optimize exactly what you said. I'm sorry, what's your name?
I'm Tim Klena.
Thank you. I was like, I hate to
Sure.
be like you. We can optimize based on genetic need, but we're not looking at the epigenetic part. That's that 80% that you get to then come in and tailor and support for them. So we get to help with that 20%. The next one is the skin report. As of right now, we don't have DNA-based product, but we are working on it always. This was my baby to right. My uncle died of skin cancer when he was 32. It's kind of young. We watched it. It was awful. I worked in dermatology, did a couple rounds through dermatology, and I loved it and I hated it. Because by the time people came in and saw the dermatologist, they were pretty late stage. Or they had something that was going to take some time to help support or get rid of. It started to become a screening process after they came in for the initial, or if they noticed they had a family history. But otherwise, how many people just go to the dermatologist bi-yearly because they think they should? Good for you, because a lot of people don't. This is looking at, we have to be very careful on our verbiage, of course, skin glycation, how our skin ages, fine lines, wrinkles. See, this is what I'm talking about. He says I'm young, but I'm actually not. I looked at all this and said, how do I optimize this? Let's do that. Whether you need water-based versus oil-based products. How do you know that? Based on your skin, well, it changes during the seasons, but if you know based on your DNA, then you can tailor certain projects and skincare regimens based off of what it says for your DNA as well. If you should wear sunscreen, if you should wear more sunscreen. Notice how I didn't say no sunscreen, because it's the people that go out there and say, oh, I don't burn, I'm fine. Those are the ones I worry about the most, because they're absorbing the sun, but what is it doing to them? And those are the people when we saw in dermatology that were coming back with some scary stuff. So looking at anti-aging in the sense of how to age gracefully with your skin, how to keep it hydrated, how to keep the fine lines and wrinkles, because I don't care who you are, it's not a vain thing. It's a good thing to want to age gracefully. Sports and fitness, we don't have DNA-based products on yet. And I emphasize yet. We're working hard, we're always progressing with the science. We are always looking and researching. I have 2 research days a week where I just go through and I start to see what's out there. What's new? We always update our research. In the back of your reports, you have your studies. So every time we update it, you don't have to buy a new report. It's just in your back office and it's updated. So you can print it out with your new studies and your new research that we find that supports exactly what we're doing here. If I can't support it, I can't do it. Even if I say, because I said so, legal goes, no, that doesn't work. So because I said so works at home, but not here. So making sure we validate what we do with science and peer-reviewed studies, of course. So DNA-based products, we have 2. Healthy aging, weight management. We have 4 reports total. I'm sure there's people here that can answer about the questions when it comes to pricing and different things like that. I stayed in my lane, which is the science. Do you have anything you want to add? Because I could go on forever and keep these poor people here all night. I don't want to do that.
Yeah, what I'd like to see, kind of go to the basics. So you're talking about anti-aging or vibrant aging. Yeah.
Mm-hmm.
So what causes a person to age faster?
A lot of factors. Smoking, drinking, healthy, the epigenetic part. Now, when it comes to the cell part, it's because our cells become what we call, I like to use the word zombie cells. And I said this to a gentleman once, and he goes, is that a scientific term? And I said, well, yes, it is. Think about it.
Can you kill zombie cells?
No, you really can't, right? I mean, there's the whole brain thing. You got to get them in the brain, but how do you know how to do that? So zombie cells are cells that become hard and rigid. They don't let good in, they don't let bad out. And they go around the body and they wreak havoc. They cause us to age, right? They're due to factors of all the epigenetic stuff that I was talking about originally that can happen. So if we don't understand how do we get rid of these with healthy detox pathways, right? And preface those healthy detox pathways with that methylation or that cellular energy that I was saying, then we don't know how to get rid of them. So we want young, vibrant cells. We want our cells to die. We want new, young cells in there. We can't regenerate cells, we age.
So
it shows here, but it shows internally first.
So we can actually have zombie cells in our face.
We can. So oh my gosh, everybody on Facebook is going to be like, she said we could turn into zombies.
That's scary. Okay. So how do we get rid, because obviously no lady want to have a zombie cell in their face.
No.
So how do we get rid of zombie cells in our face? Is it through
It's
like this
internal.
cream? Okay, so it's internal.
Internal, but we also, thank you for mentioning that. We also have a great topical serum that utilizes a product that we call AC11, which is cat's claw. It's a very unique form of cat's claw as well. So it is an herb, cold water extracted. And what it does is they have 25 plus years of clinical data and studies that shows that it lengthens telomeres. Okay, who doesn't know what a telomere is? Okay, my best analogy, my favorite, it sounds like I'm talking to you like a child and I'm sorry, but I'm not. You know the plastic tips on the end of your shoelaces?
Yeah.
You know how they keep your shoelaces from becoming frayed? Those are telomeres. They keep your DNA from becoming damaged. So we want them long so they can protect it. The shorter they come, the more exposed our DNA is and can become damaged. Can we reverse that? We can. But if we don't know, or we don't take or do the right things, so this product, AC11, has been known to enhanced collagen types 1, 2, 3, and 5, and also lengthens telomeres. Helps with elastin. What's in our skin and our face? Elastin and collagen. So you can use this topically to help with fine lines and wrinkles, and then helping internally by taking the right things, the right antioxidants to help the zombie cells die off, will keep us younger.
So this is a better option than if you do because elastin, then it's actually elastic, which means that it can contract and expand, versus if you do Botox and it just kind of yeah, that is like an all zombie cell right here. Okay.
And then you go back to normal, right? You know, after like 2-3 months, I worked in dermatology. I did try it. I can tell you that I hated it. It gave me the worst headache ever. But it's just, and then it paralyzes. It's a neurotoxin, right? It's a toxin. If we don't detox well, we're going to hold on to these neurotoxins and create more zombie cells. So it actually could be a negative feedback for a lot of people.
Yeah, it was funny. I was at a dinner with a mother and daughter. They were owner of a med spa, and the daughter was only like 20-something.
Oh no.
And the daughter, or the mother, was probably, I think, young 50. But it was fascinating as they were communicating. There was no facial expression. All emotions were hands, so they had to show anger with hands and happiness with hands and everything. But here was just still the same. So,
which is attractive for like a moment, and then afterwards you're just like, I know. If you don't get like the angry lines and stuff in your face, then
yeah, I'm really angry right now. So the telomere, I mean, in essence, anti-aging, well, not anti-aging, vibrant aging. We want to age vibrantly. So this is you being 80, this is me being 105. Yeah, so that's right.
I was going to reverse that.
Oh, whatever. And
Yes,
one thing is when you go to a medical doctor and you ask them, so what should I do to stay healthy? And he's sitting there in his chair. He's about 250, 280 pounds, about ready to have a coronary and breathing heavy. And so you're listening to this gentleman as to what it is that you should do to stay healthy. And obviously, I don't rely on that information because obviously that's not good information. Because here's proof in the, a lot of pudding. And here
Proof
you.
the lab coat.
Yeah, exactly. Yeah, something that's holding it all in, the lab coat. And here you get to see somebody vibrant that obviously no Botox, and
you can see my lines, see?
Yeah. Not ready to have a coronary. So I'd rather follow somebody that actually looks vibrant and young. So thank you for that.
Thank you.
And it's good to be a scientist that actually, she's communicating pretty well to the public, don't you think? Uh-huh.
It's because I'm not a political scientist.
Yeah, that's what it is. So in essence, vibrant aging is you want those telomeres to expand those telomeres, or those little kind of ends on your DNA, and so the faster they break down, the faster your cell will die. And obviously, aging, if more cells die than get replenished, the faster you age, right?
Correct, yes.
So with supporting your genetics, I would assume you support the energy of the cells so that they can repair faster.
Yep, mitochondria, exactly. Enhancing ATP production, allowing the mitochondria, which does help us keep young, does help regenerate, there's a lot of mitochondria in our muscles. You hear people who get muscle atrophy, who just can't build muscle or strength anymore. That's a quick way to age, and that's uncomfortable, and it's not fun to deal with. Prefrontal cortex holds a lot of mitochondria there, so there's some wrinkle analogy for you as well. Women, ovaries hold a lot of mitochondria, so ovarian issues and things that reproductive issues, right, can be a sign of aging to women if we can't have babies or we can't do those certain things anymore. So mitochondria, it does help regenerate new cells, put energy into the cell, as well as methylation, that pathway we were talking about, that prefaces mitochondria, actually. So you don't take the right form of even just a B vitamin. You think it's just a B vitamin and all the cofactors that are involved in that process, then you don't get to preface our mitochondria. You don't, our Krebs cycle, which prefaces the mitochondria, right? Or detox, or the immune and inflammatory response. So just one little area can have an effect on so many different things.
So I usually liken it to, if I want to go from point A to point B, I want to get there as fast as possible. I did get a speeding ticket this weekend, so. But with that, then you want to have as fast of a flow as possible. So if you go on like a 6-lane freeway, and then all of a sudden that gets shut down to 1 lane, obviously we know what's going to happen, with traffic at that point. But it's very similar to your genetics. If you have these kind of genetic dysfunctions or genetic SNPs, it's kind of like you can get shut down to 1 lane. And then obviously you're not able to get the end results as quickly, so you're not able to get rid of the toxins as fast, you're not able to repair the tissue as quickly, you're not able to produce energy as quickly, and that, wherever that is gonna impact us.
And it's different for everybody, always.
Yeah, so wherever our strongest weakness is, that's just gonna show the most. So obviously as an athlete, you want to be able, like you're saying, repair quickly. So a lot of us, when we're young, we don't think about that because we can kind of compensate because we're young.
Yes.
And so we don't think about that we are aging faster even though we still look young. So if we're training and want to repair big strength, build strength, it is important that to make sure that we maximize that repair even though we look young and we don't see any reason. So it's almost even more important at that time to set that stage to support your genetics.
Oh, you're like a blank canvas when you're young. That's the best part of it, is to start at that point, because we want to, the 3 things I always tell healthcare providers: enhance recovery potential, how your body recovers from everything, whether it's a virus, whether it's exercise, whether it's exogenous threats, whether it's lifestyle, whether it's stressors, doesn't matter what it is. The quicker you can recover and bounce back, like you were when you were 18. You go on a weekend binge where you're drinking a bunch or eating really bad, and you come back on Monday morning, you're like, whew, and the 18-year-old's like, sweet, I'm going, and just did the same thing. It doesn't happen because they don't realize that their body is going through this process already until they can't do it anymore. And at that point, you're starting to look at symptoms that preface certain conditions. So why not stop it when you're young?
So, and then, as we get older, we want to make sure our testosterone is high as men, and then females, obviously, hormones are right where they need to be, to protect our heart, obviously, so we look youthful, but also energy, brain, how we feel emotionally. So, supporting then the mitochondria everywhere, and also supporting the process of producing these hormones becomes important, and that's, the genetic plays a role in that.
It does.
Yeah.
It does. We've been able to have people, on Euphoria that have come to us and say, I used to be really emotional and dramatic, or I used to have, premenstrual tension syndrome, PMS or whatever, heavy cycles, and that's bounced out for me, and I'm not doing anything to my hormones. Well, there's things that preface hormones. They just want to give you hormones. Instead of having your body naturally produce what it's supposed to and supporting those, they're saturating or giving you something so your body's like, okay, I don't need to do this anymore. I'm getting this from an exogenous, source. I'm done now. Well, we don't want that to happen. We want the body to constantly, even though as we do gracefully age, those processes will start to slow down, but we still want to support them.
Yeah, and questions?
Quick question, and that we keep referring to the 20% to 20% rule, that, this is helping that 1/5 of that whole picture of that patient. And yet, we as physicians, many of us are still trying to get that 4/5, that other part, that family life, squared away for them, which of course we have nothing to do with, but that emotional, psychological barrier that we keep getting hit by. But I just kind of know that this has this type of stuff has a place in everybody's practice, because it's not truly replacing what you're doing.
Correct.
I don't see us having to carry tons of product. I see it as a 2-part kind of equation. One, do you want to get genetic testing done? Do you want to know that there's help for just you and you alone? And if they say yes, okay, great. And then they'll get back this report. Is this what I'm hearing? You get back a report,
Yes,
and then you have that opportunity to purchase a solution for this report.
Exactly.
So again, we're kind of like just passers-by, we're just enabling this to happen.
This
Is that
process,
true?
yeah, exactly.
Is
So
there a
the
third part that I'm missing?
that's it.
The thing that I tell my
That's it for
patients
me.
is,
Yeah.
you know, life does
And I had
this.
somebody helping me doing that.
Yeah.
She's sitting
He's-
right
he's
over there.
smart.
She's
He's
awesome.
very, very smart. Life does this.
Because I don't have time, and neither do you. So yeah.
I want to keep you here during all this. If I can keep you here, maybe a little bump in the road every
You gonna
once in a
call me
while.
lot? You gonna talk to me? You be here?
If you need me to, yes, I will.
Yeah, so the key is, like you're saying, the 80% is the epigenetic, and that's what we can control a lot with lifestyle and maximize that. Turn on, turn off genes, you know, with how we behave, how we eat. And what's cool is, and we thought then that the genes in themselves were untouchable. I mean, we were doomed because this is what we got, and we can't do anything with it. So this kind of new field of nutrigenomics, you know, using the nutrition in order to be able to maximize your genetic weaknesses and turn them on, which will make then the other 80% that you're working on even that much more effective. Doesn't mean that you should neglect that 80%, but it just becomes now, you know, I'd rather have an A than the highest grade I can get is a B minus. Yeah,
Right.
yeah.
Well, that and when they start to feel better, right? When they start to get more energy, their cravings are down. They're like, okay, I think I'm going to go to the gym today. Okay, I noticed I'm not as sore as I normally am. They tend to be more active, and they start to make those slight little changes on their own. And you just kind of can say, well, here's some of the things I would recommend that's good for you. And when as soon as they start to feel better, it's amazing how they start to kind of just do things on. And I tell them all the time, they come in and they say, oh my gosh, thanks to you. And I'm like, no, you're the rock star. I could talk to you till I'm blue in my face, but if you don't do what I ask and go home and take this every day and start to notice how you're feeling and do all the other things that support this, you're not going to go anywhere. So, yes.
Yep.
It does help more than 20%. I just, from a genetic rule or standpoint, nature versus nurture, we look at, nature being genetics 20%, nurture being the 80% or what we do about it, which is this as well.
Question.
Yes.
Now, my DNA probably thinks that I still have a gallbladder, but does that have an influence on what I would eat or take? Or?
Yeah, well, definitely in what you eat, but
But
so
would it show up, though?
not in a genetic variant. It's not going to show up if there's. Okay, I'm going to get off topic, so I won't do that. In the 18 that we test, no, it won't show whether there's a gallbladder issue or not. It does talk about detoxification and such, yes, and yes, you should eat differently if you no longer have a gallbladder. But because what we are giving you, we want it to be absorbed in the cell. We want it to be highly bioavailable, so that way it doesn't have to go so much through the digestive process. It does a little bit. There are some that do, of course. All nutrients of some sort are absorbed in different parts of the body. But if we can get them to absorb mainly in the small intestines and then in the cells versus going through the liver, the gallbladder, the stomach, and then the urinary bladder or whatever, and you have expensive stool or urine, we want it to be absorbed in the cells. So that we've noticed that people, let me rephrase this. In my practice, I noticed that people who didn't have a gallbladder or who had slight liver toxicity, their liver functions would actually, and kidney functions even, would actually balance out because they're utilizing things that they know their body knows what to do with, and it doesn't eliminate as waste. If that makes sense?
Thank you.
Okay. Just making sure.
I just wanted to add that if you do have a SNP that affects gut health,
Yes.
you have a lot more than 20% is affected, obviously, because leaky gut, leaky brain, and malabsorption, there's all kinds of things that can happen.
Oh, absolutely, absolutely. No, you're right. And the way that I say when I say 80-20, it's more based on, 20% is considered, this is the ideal patient, which I'm not even the ideal patient. I've never really met, they think they're ideal, but a lot of times I'm like, go eat McDonald's is not ideal, sweetheart. I'm sorry, it's still not, even if it's just once a week. But it's hard to be 100% of the time. So when you've got you're trying to do all the right things, but then there's just something. I mean, everybody has something, whether it's 2 o'clock they hit a wall with energy, or as a woman, you know, reproductive or menses issues, as a man not being able to build as much muscle mass or having the energy that they need to get through the day. Like, there's always something small. So what is that? And then the 80% is what we get to do about it. So it's just the understanding. You don't know unless you know. I see.
So the gut health question, this might have something to do with it, but I know if someone was wanting to lose weight, you know, we've been told to start on the healthy lifestyle, you know, formulation versus the weight management formulation. So can you talk a little bit about that and why and how long?
So being a geneticist, my answer is always, it depends. And that's probably not the favorite answer amongst everybody, but I'm like, well, let me dissect this one certain person. That's
Is
that's
that
how my
poli-sci
level is.
right there?
Yes.
Okay.
So that's how I look. Is yes. But so the reason we say to start on foundational or the healthy aging is because it's a lot of times we've had a lot of people here, and we've noticed a lot of people that have had. It does address the gut more. There's a FUT2 gene on it. That talks about healthy microbiome and absorption of nutrients based on that particular gene. And it also shows inflammatory and immune response. So a lot of people have a lot of weight gain because their inflammatory response is high. And a lot of inflammation. Now, this is just one guy. Results vary, of course. I always have to say that. We do have a gentleman who lost 150 pounds on the healthy aging. He never touched the weight management. We've had women who've been on healthy aging and haven't lost anything. They go on the healthy age or the weight management one, and they lose 30, 40 pounds in a particular time based on whatever they're also doing. So it depends.
So it's almost like you gotta ride one horse, you know, for a bit until you don't feel you get to the point, and then you jump on the other horse.
That's a good analogy. I always go cars.
Oh, okay.
Not so much.
Yeah. That's a scientist. I'm an old school. Yeah. Old, young.
I guarantee I'm not that much younger than you. Watch, we're going to compare age. I'm still waiting to see both of your genetic reports framed up there so I can see. I actually already know because I can look. But I think all of your patients need to see that as well.
I'll see all our innards.
Very vulnerable and exposed,
Yeah, I
right?
feel so naked.
But it totally does depend. And the healthy aging, like, nobody can go wrong with healthy aging, of course. Working on immune, inflammatory response, microbiome, those kind of things, nobody can go wrong. Here's what I tell people with the healthy weight management. These are, like I was saying, the people who have addictive food behaviors or addictive behaviors in general, and it can lead to other things such as sugars and food. We know sugar is highly addictive, and it's been proven in science through functional MRI, actually. If they have issues with insulin resistance, or they have a family history of type 2 diabetes, if there's a history or personal history or family of polycystic ovarian syndrome in women, those are the kind of people that are, or the people that are just like, I can't stop eating. Those are the kind of people that might benefit from this initially, the healthy weight management one, but should go on to the healthy aging after however long they feel they need to. It's dependent upon each person.
Can you take both?
Not right now. I do have to change the formula a bit, because if you take both together, it's what we call hypermethylate or overmethylate, because there is B vitamins in both. And if you have the MTHFR and you've got a red in both, you're going to get way too many B vitamins, and you're going to go, I don't understand, but I don't feel that great. And I don't want that. So as of right now, no. However, what you can do, and I'm not going to try to confuse people, but if you were doing your nutrition, that's one thing we didn't talk about. There are pre-products to each of the DNA-based products. Sorry, I'm sorry, this is going on. Pre-trition is the pre-product to nutrition, right? So what is that? It's great antioxidants. Okay, it's a lot of enzymes, prebiotics, things like that that help the microbiome, that help the gut, that help the zombie cells, right? So they're getting the body ready, or prefacing the body for your nutrition. Because if your cells are, you got zombie cells, or you've never really taken good nutrition before, besides maybe in your foods, when you take this right off the bat, you either might not feel well, you might get that die-off effect that some people get, or it might not be as beneficial to you. So we come in with a pre-nutrition, we call it, which just helps get the body ready for this, which is 30 days. The weight management, which has, oh gosh, I don't mean to confuse you guys, I'm sorry. Prime, which is the DNA-based.
You're allowed to.
I know, but not in the same way as a lot of other scientists are. I'm going to try to not do that. Prime, which is our DNA-based weight management product. The pre to that is called Core. That helps the body with blood sugars, with cravings, things like that. Helps support the thyroid in a healthy way with selenium. Doesn't change thyroid functions. We just balance and help support the thyroid. So it's using things to help support before you actually get your DNA-based stuff, so your body knows better what to do with this. So why I say that, you can take nutrition and Core, which is the preface to the weight management, or you can take pre-nutrition and Prime, which is the DNA-based weight management. Does that make sense? You can do those two together because I don't have heavy B vitamins in the pre stuff, because obviously we want your body to know what to do with those B vitamins. You start taking a lot of B vitamins right off the bat, you might not feel so great initially either, and we don't want that. So.
And if it is confusing, then ask Andrea back there. She's also confused right now, but she won't be in a minute.
So not 2 DNA-based products as of right now. That probably will change, thanks to Kim, our CEO. But you can do the pre and a DNA-based, one or the other, that kind of thing. So.
John, to Jim.
Yeah, you mentioned thyroid. My wife said her thyroid removed. Now, would that?
Me too.
Oh, you too?
Yeah.
And this would still all work.
Yeah. Mm-hmm. Yep, I had mine removed as well, and I still am able to take all these things just fine. It actually does help as well, because your wife is probably on levothyroxine or Synthroid or something. She has to take something that's kind of giving her body still what her thyroid does, since that organ is removed. So this is going to help support all the other body systems that maybe the thyroid might have helped better, but now she doesn't have it, so we're going to come in and help support her there too. So absolutely she can.
Okay, great.
Yeah. Mm-hmm.
Any other questions? Please, Kat. Yes.
How do you decide what you start with? Is it always the anti-aging?
The healthy aging is always my recommendation. It's always the best way to start. But then you have great gentlemen here, Dr. Harmon and Dr. Karlfeldt, that will can help you decide a little further if you need help with that as well. I wouldn't put you on a weight management product. I sure wouldn't.
Yeah, but
No.
yeah, the anti-aging would be really good.
That's great for everybody across the board.
Yeah.
Vibrant aging is great. Thank you.
Vibrant aging. Thank you. Vibrant aging.
But if you start with that one, you mentioned there's things that you should take while you're waiting for the test to get back.
So while you're waiting for your test to get back, there's what we call a pre-nutrition, which is the stuff that helps prepare your body and your cells for your DNA-based stuff. So that's 30 days worth. So you can take that, you should take that actually, for 30 days prior to.
Now, if the others are formulated according to your DNA, what about the pre-stuff?
The pre-stuff is I kind of wanted that to be for everybody. So actually, I'm gonna blow your mind and probably confuse you even more, but here we go. So the pre-nutrition is the base of this. So every formula starts off as a base of pre-nutrition. And as it goes through our hoppers, which I wish you guys could see because it's absolutely amazing, this technology that we have, the base gets lower and lower dependent upon how much genetic support you need. So that's why there's so many different combinations, is because everybody starts off with a full amount of pre-nutrition or base, and it just gets lower dependent upon how much support you need.
So it's a basic formula. What's in the formula?
So it's loaded with juice and fruit extract powders. It has digestive enzymes. It has prebiotics. It's mainly to help with oxidative stress, to balance antioxidants and free radicals, right? We want them nice and balanced. We don't want one to be outweighing the other. So it's just to help to create a little bit of balance in the body and to be able to help those cells understand and be able to take in your DNA-based nutrition better and more efficiently. Does that make sense?
Yeah.
Okay.
Just what if you are one of those people that your whole immune system isn't functioning, how you know you'll do all right on that?
So I don't, well, is she a patient?
She is.
Okay, good. Well, you have this wonderful gentleman to help you walk through that too. But people who, are you speaking of people who maybe are a little more immunocompromised?
Yes.
So that's the thing. Immunocompromised people are either immunodeficient or immunoexcess, right? So autoimmune is based typically on an aggressive immune and inflammatory response, or it's either a deficient. What we want to do is we want to balance them out, and that's our goal. We don't want to create, this is high now, this is low now. We don't want to, that's what the body's already doing, and the body wants to be balanced, but it needs sometimes extra help in natural sources to help it do that. So we use as natural as we can. We do have to use some active ingredients, which don't always just come from plants, unfortunately, but what we're doing is giving your body the things that it needs to help support and balance out those immune responses. I personally, still on here, aren't I? I personally wouldn't have a problem giving a patient, as long as I was observing them, giving somebody who had immune stuff, and I've done it hundreds and hundreds of times, so.
Just the caveat for that, make sure you're under a health
Always
professional's
make
care.
sure you're under doctor's care, like this guy right here, or Dr. John Harmon, or any of these people in the room, which we can twist around and show you all these wonderful healthcare providers. Yes, always, and that's prefaced in all of our literature as well, that we want to make sure that you ask your physician prior to, thank you.
Or Dr. Easter.
Exactly, any of these, right, any of these amazing doctors. Make sure that you're talking to your healthcare provider prior to, or although I'm going to understand it or appreciate it, probably not. But if you're immunocompromised or having some other issues, you would want to talk to somebody.
Did you have a question?
I was just thinking about kiddos. If you guys have any formulas for kids?
Oh, I can't wait. Here's the problem with kids. 0 to 2, we dose one way. 2 to 4, you dose another way. 4 to 6, you dose another way. 8 to 12, you dose another way. 12 and up, you can usually dose as an adult. So that's a very intricate process. So as of right now, and plus, what kid's gonna take a pill?
Oh, I know.
So then you've got gummies, you've got liquid suspensions, you've got all these different forms that these kids have to take. So as of right now, we are saying 18 and up.
But it's still interesting to do the DNA test.
Correct,
And
for
to
information.
see, yeah, for information and understand. And that's the thing is that, it's very, like you're mentioning, it's very inexpensive. I think it's like $300, a little bit less than $300 for the DNA test. And then if you do both of them, then it's like $550 or something like that, for both tests. So it's very inexpensive and it's a one-time thing. And this is, forever, meaning that this is what it would have shown when you're born and is what will show when you're dying. So it's the same test, one-time thing. And so that's still very interesting as a mother when you're seeing a child that may have some challenges to then be able to address them maybe in some ways. And you still get the report where you see kind of lifestyle, what foods to eat, what not to eat, and so those are still extremely good information. And as a practitioner, I value, my motto has been I want to give as much care for as little money as possible, which means that I have to be as efficient as possible during the time that I'm with the patient, in order to be able to do that. So for me then to sit down, it's just not worth it for a patient for me to sit down and decipher this huge amount of data and then distill that into information that's usable and a product that's usable. So to then have somebody that's doing that, it will save money, the patient's money, because they don't have to pay for all my time because it's an automatic process that's doing that. And then they don't have to pay for my time formulating it because it's already done, so but then for the kiddo, you can, I have some kiddos do, they kind of open up the capsules to a smaller amount and mix it, but that's me as a healthcare provider, and I can do that.
My scientist brain's going, oh please stop talking. No, I'm just kidding. I tested my daughter's DNA back when they were little too, and sorted them. I mean, they have their little regimens of different things that they have to take, but they're teenagers now, so it's different. But I think it's great to look at kids' DNA. Absolutely.
And I think it's more and more important now. Again, they're the emotional stressors and the physical stressors that's out there. What's interesting, talking about what we're dealing with now, all kind of spike proteins floating around everywhere. So what we know about that is that it downregulates the mitochondria. That's one of the main thing that it does, and that's like when we're losing our smell and taste. It's because it's downregulating the mitochondria in the nerves.
The really bad muscle pain and stuff as well. Yeah.
So that's kind of one of the bigger things, in addition to then the inflammation. So by using things that then maximize the activity of the mitochondria becomes then really important. In addition to then working on the inflammatory aspects and you working then on looking at what's in the ingredients, the natural substances that are used are very potent in regards to controlling a lot of the inflammatory aspects. So and what they've seen also with what's going on with these spike proteins is that it also downregulates what's called this CD8, or the part of the immune system that patrols and checks for cancer cells and checks for a lot of different things in regards to our immune system. So so to be able then to kind of upregulate and support in the areas to kind of protect ourselves against these little agents that are floating around becomes really important. I think more now than ever, because I don't think we've really seen the full end of what's going on. So, and it's with the children as well. Okay. I talk about this all day long.
Yeah. I love talking about it, but
You shouldn't. No.
Especially not on that.
No.
I just wanted to add that when you sign up with Euphoria, there's a training video section at university that teaches you and educates you on all of the SNPs and the things that
I did. Thank you for saying that. I spent a full day, lost my voice. I wrote like 20,000 words to create this video, so please utilize it. Yes. But I did. I went through. It's a little scientific, maybe. I need to probably. We're going to create some things to help. And I don't like the word dumb it down. Nobody needs to be talked down to, but I need to be able to talk to, across a bunch of different levels. It needs to be very relatable. But it is, I believe, I don't know. I believe it is.
Great information. I found it very educational and useful.
Good, thank you, because I'm like, it's hard to talk science and sometimes not talk science. So I tried to keep it, yes, very relatable, very understandable, very digestible, as I like to say. So yes, please utilize that, because it runs through every SNP and your particular result. So if you have one copy of a particular parent, it's interactive. You click on it and it tells you what that means for you based on somebody else who has two. So more, genetics, we want to be as precise as possible to each individual, of course. Thank you for bringing that up.
Any other questions? Cool. Do
Thank
you have anything
you.
more you want to say? I think we said a lot.
Oh, we did say
Maybe end of Facebook Live.
Peace out.